Today we're going to talk about ADHD. So what is ADHD and what are symptoms associated with ADHD? ADHD, or attention deficit disorder, is defined as a neurological developmental disorder that is characterized by trouble paying attention, controlling impulsive behaviors, or being overly active, according to the CDC. Now, there are three types of ADHD. First is the predominantly inattentive presentation, and this person will struggle to organize or finish a task, to pay attention to details, or to follow instructions or conversations. They are easily distracted, forgetful of tasks, and do not appear to be listening when spoken to. The second type is predominantly hyperactive or impulsive presentation. This individual will often fidget a lot and be unable to sit for long periods of time, feel the need for constant movement, they talk nonstop, interrupt others, blurt out answer, and often struggle with impulse control. This type is most often characterized in children and will mostly be characterized in males as well. And the last type is combined presentation, which this one will be 6 or more symptoms of the first type, which is an attentive presentation, and 6 or more symptoms of the hyperactive presentation. Now, what are some possible treatments that can help students with ADHD? And do they differ from presentation to presentation? ADHD is best treated with a combination of behavioral therapy and medication. However, we need to consider that medication is not always the answer, and you don't always have to take medication for it to be effective. But if we are to take medication, there are two types that are taken, which are stimulants and non-stimulants. Stimulants are best known and most likely used to treat ADHD because they are fast-acting medications. However, they do not last a long time. Stimulants, however, do last a long time, but it takes more time for them to work. Now, in the predominantly inattentive presentation, individuals work better in a quiet space where they are kept away from distractions. If they have a to-do list or a planner, that will help them gauge what they need to get done. They need a specific area to focus on, and also taking short breaks and rewarding those individuals will help them stay on task. Now, predominantly hyperactive impulse presentation, medication seems to be the most effective, along with behavioral cognitive therapy and increasing environmental structure. Now, the reason that these are effective is because ADHD is recognized as being associated with an impaired cognitive development, so this affects executive and non-executive functions such as impulse control, working memory, and reaction time. We as teachers can accommodate to children with ADHD by providing alternative seating, so they may have a set seating schedule in the classroom. However, they may also have another seating that they can move to in the class when they feel the need to move around. Allowing them opportunities to move around and fidget. This is most often done with hands-on activities in the classroom. Reformatting documents to minimize the amount of distractions, not as much like graphics in the papers because it will mess up their concentration on the subject. Breaking down assignments into smaller tasks that are more manageable for students and allowing extended time to complete those assignments. And also, if there is testing, allowing the child more time to finish the test, and also allowing them a separate room to take the test, and that is more quiet and away from distractions. There is also a role that parents can play in this by allowing them to create a schedule with their child, helping them manage distractions at home, limiting choices so that students aren't overwhelmed by too many options that they have to choose from, being clear and specific when talking to that child, and breaking down tasks as well also helps. And also just using discipline effectively. We don't want to punish students because they're unable to focus. It's not something that they can control, so just being positive with them, praising them, and rewarding them when they are on the right track. So this is a short little presentation about ADHD, what it is, some symptoms, and possible treatments that can be used. So thanks for coming.